poor circulation, memory problems that creep in slowly, and in some cases, a heart that starts to fail. All three of these have been linked, in ways most people have never heard, to something as small and as easy to brush off as waking up with a dry mouth. Most of us do the same thing when it happens. We reach for a glass of water, swallow it down, and move on with the day. But what if that dryness isn't really about thirst at all? What if your body has been trying to tell you something for months, maybe years, and no one ever taught you how to listen? Here's the part that genuinely unsettles me every time I sit with it. Nearly 1 in 3 adults over 60 deals with chronic morning dry mouth. And in the vast majority of those cases, it has almost nothing to do with how much water they drank the night before. Nothing. This isn't something you'll hear discussed at the pharmacy counter. It's rarely brought up at a routine checkup either. It simply slips through the cracks of modern healthcare, one symptom at a time. Stick with me to the end, because the cause that ranks number 1 on today's list may be sitting in your medicine cabinet right now, and it could be doing far more than just drying out your mouth. We're talking about something capable of touching your kidneys, your heart, and your brain, all at the same time. Let's start by understanding what's actually happening inside your body on those mornings when your mouth feels like it's lined with cotton. Saliva isn't just water, it's a remarkably complex fluid, loaded with enzymes, minerals, antimicrobial proteins, and protective compounds that work around the clock to guard your teeth, your gums, your throat, your digestion, and even your immune system. When the glands that produce saliva slow down, or when something else in the body begins to struggle, saliva production drops, and once it drops far enough, your mouth dries out, especially overnight, when you're not drinking, not talking, and doing nothing to keep that natural flow moving. After 60, the body is already producing roughly 30 to 40% less saliva than it did in your 40s. That decline alone creates vulnerability, but it becomes something genuinely worth paying attention to once it overlaps with any of the 7 causes we're about to walk through, because not one of these simply dries out the mouth. Every single one points to something happening underneath the surface. Here's what concerns me most as someone who has spent years working with patients on exactly this issue. Chronic dry mouth has been associated with a 45% higher risk of systemic infection in adults over 60. Saliva is essentially the front door guard of your mouth. Take it away, and bacteria, fungi, and viruses suddenly have a much more direct route into your bloodstream. So today we're going through all 7 causes, starting with the least serious and building toward the one that worries clinicians the most. By the time we finish, you'll know exactly what to watch for, what questions to bring to your next doctor's visit, and what you can start doing differently tonight. Before we go further, I want to ask you something. How long have you personally been waking up with a dry mouth? A few weeks? A few months? Years? Drop your answer in the comments below. I read through them, and your story might be exactly what helps someone else watching realize they're not imagining this, and they're not alone in it. Number 7 is the cause I see more than almost any other, and it's also the one people dismiss the fastest: breathing through the mouth while asleep. Before you assume this one is obvious or harmless, I want you to really hear this. In clinical experience, mouth breathing at night is almost never just a habit. It is, far more often, a symptom of something else entirely, and that distinction changes everything about how seriously we should take it. When air moves directly across your tongue, the roof of your mouth, and the back of your throat all night long, it evaporates moisture far faster than your salivary glands can replace it while you sleep. That's where the sandpaper feeling at 6 a.m. comes from. Along with cracked lips, a thick, coated-feeling tongue, and sometimes a sore throat that has nothing to do with being sick. But here's the piece that worries me more than the dry mouth itself. Mouth breathing during sleep is frequently tied to nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea, in particular, is not something to wave off as just snoring. Research has linked untreated sleep apnea to a 60% increase in stroke risk and a 40% increase in the risk of developing heart failure. If you're waking up dry-mouthed and you also snore heavily, wake up feeling unrested no matter how long you slept, or someone close to you has noticed pauses in your breathing at night. Please don't file that away as just how I sleep. Bring it up with your doctor and ask about a sleep study. That one conversation could matter more than you realize. For people whose mouth breathing isn't connected to sleep apnea, there are some genuinely simple, effective fixes. A nasal strip across the bridge of the nose before bed can noticeably open up airflow, encouraging the body back toward nasal breathing. A bedroom humidifier kept between 40 and 50% humidity cuts down on overnight moisture loss significantly. Sleeping on your side instead of your back reduces the tendency to breathe through the mouth in the first place. And a thin strip of surgical tape placed gently and vertically over the lips. A trick sleep specialists have quietly used for years. Retrains the body toward nasal breathing over time. Many people notice a real difference within the first week of trying it. Number 6 is the mistake almost everyone makes, and it's one that feels completely logical, right up until you understand why it doesn't actually work. Most people who wake up dry assume the fix is simple. Drink more water before bed. So that's exactly what they do. A full glass right before the lights go off, and yet they wake up just as dry as before. Sometimes more frustrated because they did everything right and nothing changed. Here's the reason. Your body doesn't hydrate in real time. Once you drink water, it takes anywhere from 30 minutes to 2 hours for that fluid to be absorbed and made available for functions like saliva production. Water you drink at 10 p.m. is doing almost nothing for your mouth at 6 a.m. By then, that window has already closed. The real issue usually happened hours earlier, in the afternoon. One study found that adults over 60 who didn't keep their fluid intake consistent between noon and 4 p.m. were 62% more likely to experience significant overnight dry mouth compared to those who stayed hydrated steadily throughout the day. 62%. That's not a minor gap. And after 60, this becomes harder to manage instinctively because the body's thirst signal becomes noticeably less reliable with age. You can be meaningfully dehydrated and feel almost no urge to reach for a glass. Many people also quietly cut back on afternoon fluids specifically to avoid nighttime bathroom trips, which makes sense on the surface, but it creates a deficit that peaks right when there's no way left to correct it. So the fix isn't more water at night, it's front-loading your hydration earlier in the day. Aim for roughly 6 to 8 ounces with every meal and every afternoon snack. And here's a small trick worth trying. Add a pinch of sea salt and a splash of lemon to your afternoon water. It supports electrolyte balance, which helps your cells actually retain the fluid you drink instead of letting it pass straight through. If this is landing for you so far, a quick like genuinely helps more people who need this. Find it. Now, let's keep going, because the next few causes go a lot deeper than hydration. Number 5 catches almost everyone off guard, because we rarely think of nutrition as something that shows up directly in our mouths every single morning. Your salivary glands aren't passive little structures sitting quietly in your jaw. They're metabolically active tissue that needs specific nutrients to keep functioning properly at the cellular level. And 2 particular deficiencies wear down salivary function in adults over 60 faster than almost anything else. The first is vitamin A. This nutrient keeps the mucous membranes throughout your body healthy and intact, including the lining of your mouth, throat, nasal passages, and digestive tract. When vitamin A levels drop, those membranes grow thinner, drier, and progressively less effective. Research found that adults over 60 with low vitamin A levels showed a 41% reduction in resting saliva production compared to those with healthy levels. That's not a subtle dip. That's your salivary glands running on a fraction of their normal output. The second piece is the B vitamins, specifically B3, also known as niacin, and B12. A niacin shortfall interferes directly with the nerve signals that trigger saliva production in the first place. A B12 shortfall causes the tongue to become inflamed, unusually smooth, and persistently dry, a condition called glossitis. Together, these 2 deficiencies create a dry mouth that no amount of water will ever fully fix, because the underlying issue isn't hydration at all. It's cellular function. After 60, B12 absorption drops noticeably due to reduced stomach acid, and research suggests as many as 30% of older adults are running low on B12 without having any idea. For food sources, lean toward sweet potatoes, dark leafy greens, and eggs for vitamin A, and lean meats, fish, and dairy for B12. For many adults over 60, supplementation becomes genuinely necessary too. Look for a B complex containing at least 1,000 micrograms of B12 in the methylcobalamin form, which is the most absorbable version available. One more practical tip worth remembering. Vitamin A is fat-soluble, meaning your body absorbs it far better when it's eaten alongside a small amount of healthy fat. A drizzle of olive oil or a few slices of avocado with your meal makes a real difference here. Number 4 is a combination clinicians take very seriously. And if it applies to you, I want you to hear this clearly. Not as something frightening, but as something genuinely useful, because catching it early changes everything. If you're waking up dry-mouthed, and you're also getting up to urinate more than once a night, that pairing is a warning sign worth paying close attention to. Together, those two symptoms are among the earliest signals of uncontrolled blood sugar, and in some cases, undiagnosed type 2 diabetes. Here's the mechanism behind it. When blood sugar climbs past a certain point, the kidneys go into overdrive trying to filter and clear the excess glucose. To do that, they pull water out of your body's tissues. That internal fluid loss dehydrates you from the inside, and one of the very first places people feel it is in their mouth overnight, when there's nothing they can do in the moment to compensate. What makes this especially important is the timeline involved. One study found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and that most of them had experienced that exact symptom for over a year before their diagnosis ever came through. Over a year of their body quietly signaling that something was off every single morning. I think of a patient, a sharp, active woman in her early 70s, who came in for something completely unrelated. She mentioned her dry mouth almost in passing on her way out the door. A few targeted questions later, was she waking at night to use the bathroom? Had she noticed unusual afternoon fatigue? And the answer to both was yes. A fasting glucose panel that same week came back at 148 milligrams per deciliter. She'd been living with undiagnosed type 2 diabetes for well over a year. Within 4 months of targeted dietary changes, daily movement, and the right supplementation, her fasting glucose had returned to a healthy range. At her follow-up, she told me, "I finally feel like my body is working with me again." That's what catching something early actually looks like, not a crisis. An opportunity. Number 3 affects roughly 4 million Americans, and yet the average patient waits nearly 3 years between their first symptoms and an actual diagnosis. That delay isn't a flaw in medicine itself, it's a gap in the conversations happening inside the exam room. The condition is called Sjögren's syndrome, an autoimmune disorder where the immune system mistakenly attacks the body's own moisture-producing glands, primarily the salivary glands and the tear glands. The result is persistent dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, wider effects on the joints, kidneys, and lungs. Women over 60 are disproportionately affected, making up nearly 90% of diagnosed cases. So why does it take so long to identify? Because every symptom tends to get treated in isolation. The dry mouth gets blamed on aging. The dry eyes get blamed on screen time or allergies. The joint pain gets labeled as ordinary arthritis. No single doctor connects all the dots, and underneath it all, the autoimmune process keeps quietly progressing. Here's the clue worth carrying with you. If your dry mouth consistently shows up alongside eyes that feel dry, gritty, or burning, and especially if you're a woman over 60, ask your doctor specifically about Sjögren's syndrome by name. A blood test checking for 2 specific antibodies, anti-SSA and anti-SSB, can identify the condition in most cases. You're entitled to ask for that test directly. Don't wait for someone to offer it to you. There's no outright cure for Sjögren's, but there are real effective treatments that manage symptoms and slow its progression. And for immediate relief while you pursue answers, sugar-free gum containing xylitol is one of the simplest tools available without a prescription. It stimulates saliva flow while also working against the bacteria that thrive in a dry mouth environment. Number 2 isn't something most people would ever connect to a dry mouth on their own, but the link is real, it's documented, and every adult over 60 deserves to know it exists. Your salivary glands don't operate independently. They're governed by your autonomic nervous system, specifically the parasympathetic branch, the part responsible for rest, recovery, and digestion. When that system becomes compromised, salivary output declines, and the mouth dries out as a result. What makes this significant is that autonomic nervous system dysfunction is a recognized early feature of both Parkinson's disease and Lewy body dementia. Research suggests these autonomic shifts can appear 4 to 6 years before the more classic motor symptoms that typically lead to a diagnosis. I think of another patient, a quiet, observant man in his late 70s who had brought up a persistent dry mouth across several visits. We worked through every obvious explanation together: medications, sleep position, hydration habits. Nothing fully resolved it. Then, during one appointment, his wife mentioned, almost casually, that he'd stopped recognizing the smell of his morning coffee. He'd noticed it too, but hadn't said anything, assuming it wasn't related. It was related. A referral to a neurologist and follow-up imaging confirmed early Parkinson's disease. He was understandably shaken, but because it was caught early, he was able to start neuroprotective care and build a long-term plan well before significant motor symptoms ever developed. Years later, his quality of life remains genuinely strong. He told me once, "I almost didn't mention the dry mouth. I thought it was too small to bring up." Nothing is too small to bring up. Your body is constantly communicating with you. The work, for both of us, is learning to actually listen to it. And that brings us to number 1. The cause seen most often in clinical practice, and the one most consistently overlooked, underexplained, and frankly, deserving of a far more honest conversation than it usually gets. Over 500 commonly prescribed medications list dry mouth as a known side effect. 500. For adults over 60 who take an average of 5 or more prescriptions daily, the combined impact on saliva production and on brain health can be significant. The drug classes most often responsible include antihistamines, antidepressants, blood pressure medications, bladder medications, antipsychotics, and certain pain medications, including muscle relaxants. What makes this genuinely worth understanding is something called anticholinergic burden, the cumulative neurological effect of taking multiple medications that block acetylcholine, a key neurotransmitter. High anticholinergic burden has been linked across multiple large studies to faster cognitive decline and a meaningfully elevated risk of dementia. The dry mouth isn't the real problem here. It's the visible signal pointing towards something happening at a much deeper level. I think of one more patient, a man in his mid-70s who described waking up every morning feeling like he'd swallowed chalk. He'd been on the same combination of medications for years, and no single prescribing doctor had ever reviewed the full list together at once. A careful medication review revealed 2 drugs with overlapping anticholinergic effects, both of which had safer alternatives available. We made the switch. Within weeks, he noticed a difference. Within 2 months, he said, "I wake up feeling like a normal person again, and my thinking feels sharper than it has in years." That wasn't coincidence. That was simply someone finally looking at the full picture. So here's where to start, beginning tonight. Skip any over-the-counter sleep aid containing diphenhydramine. A low dose of melatonin, around 0.5 to 1 milligram, is a far gentler alternative. Run a humidifier set to 40 to 50% humidity. Front-load your hydration through the afternoon rather than the evening. Brush with a fluoride toothpaste formulated for dry mouth before bed. And try a nasal strip tonight just to see how it feels. Then, sometime this week, write down every medication you currently take and bring that full list to your doctor. Ask directly, do any of these suppress saliva production, and is there a safer alternative? You are not broken. The information simply hasn't reached you yet. And starting right now, that changes. Before we wrap up, I want to know, which of these 7 causes surprised you the most? Which one made you think that might actually be me? Share it in the comments because your story might be exactly what helps someone else finally connect the dots for themselves. And one more thing. Where are you watching from? Drop it in the comments below. If this video gave you something useful today, hit that like button and consider subscribing for more honest, practical health conversations built specifically for adults who want to take real ownership of their health as they age. Share this with someone you care about, a parent, a spouse, a close friend, because sometimes the smallest detail is exactly the piece of information that changes everything for them. I'm Dr. Josephine, and this has been Dr. Josephine Healthcare. Aging doesn't take away your body's ability to recover. It simply asks you to start listening to it a little more closely. Take care of yourself, and I'll see you in the next one.